Hello, my name is Ralf Friedrichs. I'm an addiction recovery coach and the host of the Take Your Life Back Today show. I want to continue with this next segment. It's the greatest rise in heroin use was among white people, and that's what a study has shown. The numbers are startling. In 2015, 52,404 people died from drug overdoses according to the U.S. Center for Disease and Prevention. 63% of those deaths involved opiate usage. More people die from drug overdoses than from guns or car accidents. At the peak of the AIDS epidemic in 1995, 43,115 people in the United States died from that disease. 25% of all overdoses are from heroin. Furthermore, in 1999, the number of overdoses from prescription opiates like oxycodone and hydrocodone, as well as illicit drugs like heroin, have quadrupled. In fact, heroin now accounts for 1 in 4 overdose deaths in the United States. Now, a new study in the Journal of JAMA Psychiatry looks beyond the total number of overdose deaths to get a better picture of how heroin use patterns have changed since 2001. Since then, my friends, the number of people who have used heroin has increased almost 5-fold, and the number of people who abuse heroin has approximately tripled. The greatest increase in the use occurred among white males. Heroin use is on the rise, no matter which way you want to look at it. Deaths of despair fuel rising midlife mortality for white Americans has gone up tremendously. Some of the folks have looked into this situation and have gotten responses of 79,402 individuals collected between 2002 and 2001, or 2012 and 2013. They did a survey on alcohol-related conditions, a long study conducted by the National Institute of Health to get a better grip on alcohol and drug use and abuse. While heroin use between whites and non-whites was fairly similar in 2001 and 2002, results may be at 0.34%. Respectively, by 2012 and 2013, the percentage of whites who had used heroin jumped to 1.9%. It went up from 0.34 to 1.9%. Just 1.05% were non-whites in 2012-2013. Heroin use also increased significantly among those with high school education or less, as well as those who had lived at 100% of federal poverty line. According to a 2016 Surgeon General report on alcohol, drug, and health, only 10 of those with substance use disorder receive any treatment. The good news here is that among all drugs and drug abuse, heroin and opiates have far the best treatment medications available. Methadone and buprenorphine have proven effectiveness data. They not only reduce the chances of dying from opiate overdose by 50%, they support people being in recovery from their addiction and reduce healthcare costs and improve wide areas of other outcomes, said Caleb Banter-Green, an associate professor of health services at the University of Washington. Banter-Green was not involved in the study, but the study was based on looking into where and how it all became so significantly increased within 9 years. The study also confirmed the idea that many heroin users start by using prescription opiates like oxycodone and hydrocodone, and it confirmed approximately 1/3 of all white heroin users reported using prescription drugs for non-medical purposes in 2001 and 2002. By 2013, more than half of all white heroin users started initially by using prescription drugs. For non-whites, the number of people who started by using prescription drugs before heroin actually dropped in the same time frame. We got to remember the commercial, "This is America, this is your brain on drugs." You remember that with the frying pan? Just picture that. And things will set a better picture in your mind. The shift in practice was fueled by the acceptance of low-quality evidence that opiates has relatively benign remedy for managing chronic pain. That's what an author had written. These vast opiate supplies created a risk of diversion, opiate misuse, and disorder and overdose death. The study did not find any significant difference between looking at what age groups were using heroin, but what heroin dependency and addiction was significantly higher for those below the age of 45 and those above. They should be cause of concern, said Banta Green, who noted that one of the causes of overdoses and abuse in society is lost productivity. A county-by-county study released Wednesday by Robert Wood Johnson Foundation calculated that drug overdose deaths resulted in 778 years of potential life loss for every 1,000 people. This report also found that most of the increase is premature deaths 15 to 45 years old due to drug overdoses. And while no community is immune to these crises, suburbs, which used to have the lowest rates of premature deaths from drug overdoses, now have the highest. The authors of the study noted that the heroin use appears to have become more socially acceptable among suburban and rural white individuals, perhaps because its effects seem so similar to those of prescription opiates. 63% of all drug overdoses are white males. And out of that 63%, there's a high percentage that actually come from the suburbs. Men or people in general were taking all prescription drugs, prescribed painkillers for all these years, and it wasn't good enough, so they elevated to something even higher, something that will kill them, something that is killing them, obviously. Change your life today. Call me at 844-405-HELP, and together you and I can help you take your life back. And God bless you.